Hey guys, I am here at Inspire MedSpa at 21st and Columbia with Dr. Knife Chief. And, a couple of weeks ago, Heather was in and she was just telling me about this injection that has really changed a lot of people's lives for anxiety, depression, PTSD, and so much more. And so I'm here to get an injection. My mom and Lindsay is here to get an injection today because we both have just been like, yes, we need this. So I'm going to kind of let Sarah, Dr. Knife Chief, talk about it, and I might ask a couple of questions. If you ask some questions, Lindsay, you might catch it. Let us know if it's loud enough. Like, let her know if you can't hear us talk so that we can adjust that. But I don't know. So tell us what we're doing today.
All right, so today we're going to do a stellate ganglion injection. The stellate ganglion is responsible for our fight or flight mode. It's our sympathetic nervous system's functioning, so it's also attached to our pain centers as well. And it mediates actually a lot of systems that maybe we don't connect to our anxiety. And so a lot of people with chronic stress and anxiety, PTSD, surgical trauma, any type of trauma, the body stores it as, it basically upregulates the stellate ganglion, so it upregulates your sympathetic nervous system. And all of these micro traumas over the years actually can physically cause that system to malfunction and we get stuck in fight or flight mode. They know that system gets physically damaged. They've looked at that bundle post-mortem under autopsy in patients with chronic PTSD. And the nerve bundles, instead of being nice communicating cables back and forth, like say a telephone cable might look at, it's a dysfunctional blob that's really non-recognizable. So that system, that chronic inflammation attacks the system to where we literally get stuck. So it's been difficult trying to figure out how do we reset that system in patients. About 7.5 years ago, my colleague and I came across some data about how doing a block may help alleviate some of the anxiety and specifically blocking the stellate ganglion. But me and my colleague are very natural, professional people, and we want to do things the most natural way that we can with the least amount of complications. So we kind of put our heads together and said, how can we access this system without increasing our risk of damaging the structure? So the structure sits in the neck. It sits about this level in the neck. It sits behind these vessels and kind of behind this muscle here. So if we could pinpoint, it sits kind of right through here if you can triangulate. So a lot of people will ultrasound through the front of the neck and block it through the front of the neck. In order to do that procedure, most of the time you have to be put to sleep for that, or at least made sleepy. So you need anesthesia for it. So you need a driver. It increases the price of it. And we don't really have yet long-term data how the block affects somebody maybe 5 years down the road. Are we just blocking the structure temporarily, or are we creating changes to that environment so the structure can heal? Because we know it actually damages it, right? So we said in the orthopedic realm, when we have nerve inflammation, we use a mixture of prolotherapy, which is super concentrated glucose with sodium bicarbonate, and that calms nerve inflammation down. So we said, if part of the process is nerves getting inflamed, why don't we use a mixture that calms the inflammation down? So let's use prolotherapy, and we can access that space through the back of the neck instead of going through the front without having complications. So we initially used ultrasound, went through the back of the neck, used prolotherapy, and we were getting amazing outcomes in people. And so ever since that time, this is the way I've done it. And now we're going on 8 years, and it really is life-changing. So what it physically does is it just stops that signaling of the system, and it nourishes that system so we can get healing long-term. I tell everyone it's not a magic bullet. It's not the one thing that's going to heal your body, but it's a huge thing if we can get our neurologic system under control, because that's operating in the background without us even thinking about it. And then we take and do our part to heal the rest of our body, whether that be diet, exercise, mental therapy. People do things like EMDR, cognitive behavioral therapy. All of those pieces are put together. People can really have amazing outcomes in their life. You have a stellate ganglion on each side. although a certain percentage of the population only has one side. We don't know who that is. I always separate the injections out to see what is the response to each side. And then moving forward, we determine, did you have a better response on the left, a better response on the right, equally great responses on both sides, and what do we need to do moving forward? And so a lot of questions I get asked is, how many injections am I going to need? That really depends on the person and the level of trauma, honestly. A lot of times people with maybe mild anxiety, mild trauma-based anxiety, they might just need the 2 injections and kind of they can get back on with their life, versus somebody with complex PTSD, with dissociative identity disorder, which used to be called multiple personality. They may need an injection monthly for 6 to 8 months, and then they might not need one for 3 months, and then it might be 6 months, and then it might be a year, and then they might go on about their life. So it really just depends. We do go through the back of the neck. It just takes a minute to do. Patients describe it as an unusual sensation, a pressure. People will feel pressure down the arm and the shoulder blade because you have nerves that run and cross through that area as well. That pressure sensation goes away, but nobody ever describes it as a pain per se. Yeah. People can have immediate relief of their anxiety. And then a lot of my complex PTSD patients, they may have a period of detoxification. So they might feel physically sick for 3 days and then they start to feel better. So it runs the gamut. But yeah, I think that's what
So is this something that like children or teens can get to have done? A client of mine had come in to see you, and she noticed that even like her dyslexia she wasn't struggling with dyslexia like she normally does, and so it just immediately made us go like, can it help with ADHD or like children that are super anxious and in the classroom? I mean, I would have loved that because I was a terrible test taker.
Right.
And I was just super anxious about taking a test, and I'm like, oh, that would have been huge.
It's been used in athletes to help with their performance anxiety. I've personally used it in patients who have like schizoaffective disorder, schizophrenia, autism, Asperger's, and it helps them function better as well. Remember, the stellate ganglion is your sympathetic nervous system. It's communicating to the brain and other things. Another thing I like to point out is our chronic pain is sometimes a PTSD type memory of the body. Mm-hmm. So your sympathetic nervous system is constantly cycling through that area, especially if you're stressed out. Pain levels can go up, strictly associated with that. So a lot of times when we help calm that system down, people's pain goes away. The other thing it affects, the vagus nerve is running right next to that. A lot of people with chronic anxiety or trauma-based anxiety get gut issues. They have constipation, diarrhea, abdominal pain, just vague. They don't know where it's coming from. And injecting this stellate ganglion, it also bathes that vagus nerve too, because it's right next to it. And people get relief of their abdominal complaints as well. We had one patient in particular who was getting ready to have a hysterectomy just because they couldn't figure out where her pain was coming from. And she just happened upon this, hearing about this, and she also had PTSD. We did the first injection and her abdominal pain went away. So there's a lot of systems that are connected to this that people don't really realize. But no. Children, yes, we have injected younger kids. It just depends on whether they tolerate the needle, but we can numb the skin up. It's just the thought of the needle. So if they can get past that, then yes, we have injected younger people.
Wow, that's amazing. Can you think of any questions? It's amazing how all those questions just went right off of.
Yeah. My biggest one was the ADHD. So my son has ADHD, and we do medicate him, and to be able to even like lessen the dose, like that would be amazing. But if we think that we could actually even not do meds, because for him it became a quality of life issue. He was just constantly getting in trouble, and it's a huge difference. Like teachers can tell night and day difference if we've missed a dose during the day or something. But because he's 11, so I don't know if there is like an age cutoff.
Because we're not blocking the nerve, we're not really worried about side effects as it relates to the block. When people actually physically get the stellate ganglion block, you will get temporary side effects. It can affect your heart rhythm, it can affect your breathing, it can give you Horner syndrome or a droopy face. other issues, but we're not blocking the nerve, we're just nourishing that nerve. So the complication risk is really zero. So the only thing that it just might not help his ADHD.
Okay.
I've not specifically injected someone just for ADHD, if that makes sense.
Yeah.
I've injected a lot of patients with ADHD and also associated anxiety, trauma-based anxiety, kids that were born anxious, and it does help the way they process things when their neurologic system's calmed down. But again, I don't know that it's going to be the only thing that would help him, but there are other things that I've tried in ADHD patients, first, like with supplements and diet and stuff like that, that's helped too. But it would be worth trying again because the complications are really minimal. It would only be if it didn't help.
Yeah.
I would be injecting everyone. Like, what do you have?
Yeah.
Let's just see. I mean, it's just so amazing. And I mean, from the first client that came in to tell me, she was like, Dana, this is just a miracle. Like, I've gotten my husband back, and she was like, I can work and function, and I just don't have a million things going through my head. And I feel like that's where I've been in the last couple of years. Just a lot of stuff with business has been really complicated, and I'm the type of person, I'm like, I'm fine, I'm fine, it's all fine, it's gonna be okay. And now I'm just like, I can't do this anymore. And I was just telling my husband, I was like, man, I should have just immediately called them and like just put it in wherever it is at this point.
One of my most favorite patient stories is one of our first patients when we opened here. What do you think, that was in 2018? This patient had complex PTSD with dissociative identity disorder, and it took this patient about, they told us, maybe 6 months just to get the courage to leave the house. She was agoraphobic. Finally, when they got the courage to leave the house, there was a driver that had to drive them. They wore earmuffs, sunglasses, had a service animal. So, I mean, severely affected. 2 years later after the treatment, she was getting on a plane, flying to see her daughter graduate college, getting a PhD. She's working on several businesses, books. I mean, when I say life-changing, and she is like, I tell everybody, what do you need me to do? Just tell me what you need me to do, I'll do it.
Also, this particular person is not taking any meds either. That's because she had actually had a bad reaction for her her physician had her on 6 different medications. This was probably 15 years ago, and she had a bad reaction and caused her to have a stroke. So she didn't want to take any medication at all. So she'd just been suffering for years, and now she's doing all this, and she's still not medicated. She's still she's organizing these women's retreats up in the forest. And
Wow.
it's unbelievable.
How many treatments did she have?
She had 6 the first year.
Yeah,
Okay.
the first year, 6.
Yeah, and we saw her 4 or 5 times the next year, and then we see her maybe once, twice a year.
Maybe.
And it's
not for an injection all the
yeah,
time.
not for all the time. Yeah.
Well, that's cool.
Because our goal is I love seeing my patients, and I love to see them improve, but I don't want to offer something that I feel like I have to do for the rest of their life to keep them stable. We want to actually get healing of something so that they can move on, with that part of their life. That's kind of our goal.
That's
That's
amazing.
incredible.
Yeah.
Do you want to? Do you want to stab me while?
So I usually start on the left side in everybody, unless somebody specifically says, I get migraine headaches on the right side, I have pain on the right side, I'm always reaching for the right side of my neck when I'm stressed out. Other than that, I always start with the left, move to the right in a couple weeks.
So if you spin around this way, so you can kind of sit like this and rest your.
Oh yes, yeah, I can do that. Now I'm just doing this live because so many people, are scared of needles or the process, and I feel like since I've seen all of their vaginas, it's only fair for them to watch me.
I love it.
All right. So what I'm going to do is I'm just going to clean this area off with just some alcohol. I think her necklace is all the way too.
Oh, there it goes. Okay.
Okay, so I'm going to touch the back of your neck, okay? So the stellate ganglion sits about C6, so C7 is the biggest vertebrae that you can feel. C6 right above that. So stellate ganglion sits right deep through here. So you're gonna feel a little stick, okay? So you're just gonna feel some pressure. You're just gonna slowly go deeper. Right. You might feel something down your arm or your shoulder blade.
Yeah. It's really not bad. I mean, like Botox.
Yep. It's a pressure. It's just a
It is,
different.
the pressure's interesting.
And we're finished here.
That's it?
That's it.
Holy moly.
And I always write a little arnica. People say they might get a little soreness in this muscle right here just because we fill up that space with fluid, but it's not a pain. It's not anything you can't handle or
That's nice.
anybody can't handle. So I just kind of rub that arnica through that muscle tissue there.
Man,
But that's it.
that's
So
really
fast.
That's it.
It's fast.
That's so fantastic.
So probably between now and 30 minutes from now, you may just notice, like, some people describe it as like a full body sigh of relief. Just all of a sudden you just kind of feel relaxed. Patients, I tell patients that have been living really bad, really in fight or flight for a very long time. Sometimes there is also kind of, I don't want to say maybe a slight anxiety because they're so used to being anxious.
Yeah.
That when that anxiety goes away, sometimes we have to immediately talk it through. It's okay that you're not feeling the
Yeah.
anxiety. It's okay that you just feel like completely relaxed. That's not hurting you.
Yeah.
This is your body just going.
I can only imagine because I did live in that place for years,
Yeah.
and it wasn't until recently that I just realized, like, oh, I'm starting to, I'm feeling normal again. You know, I'm not living it here, and as soon as you get triggered in that position and you feel that anxiety in your body, it's almost crippling. And I'm going like, how long did I live in that state of mind? And so it's really easy for me to see it when it walks in the door. When a client walks in the door, they go on the table,
I can
and I'm
feel
going
it.
like, oh my gosh,
Yeah.
sister, like,
Yeah.
it's painful to watch.
To me, I can feel like this energy like vibrating off the patient.
Yes.
Yeah.
Yeah.
I'm just awesome.
I also
Maybe
like
that's
to
not
say
good.
one of the early signs that people see is that they're able to, they describe being able to step away from their emotions when they come across stressful situations after the injection. It's almost like they're able to step back and just think more cerebrally about how should I deal with this instead of just having that overwhelming emotional reaction to it. So.
Well, this is awesome,
Yeah.
and I just really appreciate the opportunity to come in here and share this with
Same.
everybody.
Thank you.
I know we're going to try and set up some time for you to come to Owasso.
Sure.
We'll set up an event there, but again, you can come and see Sarah and Heather here at Inspire MedSpa, 21st in Columbia, and I'll put that address and the link to their website on here. Okay? Thanks, everybody. All right.
Who's next?